Here we go. Welcome everybody to another big idea. This is Dr. Jeffrey Hanna here at Chiropractic, where we talk about how a small problem where your head meets the upper part of your neck can actually have very big impacts in terms of your health, well-being, and ability to enjoy the quality of life that you really want to live. Now, what we're going to be looking at in this particular video here is a specific request that was put out about a grandson who started to experience a lot of very interesting symptoms involving moodiness, involving digestive issues following a physical injury. And they want to know, is it possible that this can be connected to a problem in the upper part of the neck? And the answer that I'm going to be saying is absolutely yes. In fact, this is a brilliant illustration, and we haven't seen what's going on here, and of course this is not diagnosing over the internet, but these are the exact kinds of things that oftentimes can go on, and people don't think that we need to look to see what's going on with the health of the upper part of the neck and how this can be affecting brain function, body function, neurological function, all of these different things. It shows up in atypical kind of ways. So let's get into this one. I know you're going to enjoy it. All right, so here we have our question. We have just listened to the YouTube video on whiplash or concussion. So I'll link back to that particular video here. Would you address info pertaining to a child falling, rolling 20 steps, which is not a small amount, down a staircase at the age of 2, diagnosed with concussion, not surprisingly, since has had mood changes at snap of a finger, will start screaming, hitting for no apparent reason to adults. Also wants throw up bowl by bed because he sometimes feels like throwing up during the night. Could any of these be related to the symptoms of subluxation? Now, the short answer, as we've already said, is yes, it is absolutely possible. We're presuming here if he was also assessed for concussion, he may have had brain scans, so we're not dealing with any forms of, immediate pathology, but also from the sounds of it, again, not diagnosing, that this is something that's happened in the past, and these symptoms have been going on now for quite a while. The most interesting part here is that the symptoms are precipitated by a physical injury. You see, it would be very, very easy for us to say, oh, okay, not just the concussion, but then start diagnosing different things in terms of spectrum disorder and based on the nature of the behaviors. We could say the tantrums are just because he's a little kid, but the moodiness, oh, okay, that could be because we're dealing with, Asperger's, autism, something like that. Nevertheless, the physical injury is the precipitating factor here. And so what that suggests is that the most probable origin is physical as well. And even if there's no blood or broken bones, if you have a problem where something can get misaligned, even that little bit in the upper part of the neck, that can start causing a lot of problems. I'd use the example of having a pebble in your shoe, okay? And imagine that you have a pebble in your shoe and you haven't slept well because your kids are keeping you up for the last 3 months. Your neurology is going to be on edge, and that little bit of the rubbing can be that point where it's just blowing up and you throw your shoe off and you start smashing it in a bit of a fit of rage there. Well, the same thing can go on as if we have something going on right through here, driving our neurology nuts. What it can do is it lowers our stress threshold to the point where everything is just on edge. Any person who's been in pain for any length of time, would basically attest. It's like, okay, they are not the person that they want to be. They can feel more irritated, agitated, especially with the people who they love the most. And yet, to a certain degree, we can't help ourselves when we are in that kind of state. Major difference is that when we're dealing with little kids, they can't necessarily say, it feels like my head hurts. And even then, it can show up in other weird ways. So I'll show you some interesting research. We're going back a few years, but tying an interesting link between the symptoms of colic and migraines. And then we're going to bring it back and relate it to what's going on here, or at least what's possibly going on in terms of this young child here. Alrighty, so this was a research paper where they're looking for associations between kids who experience colic when they're really, really young versus when they grow up going on to experience migraines. And this has been an idea that's been floating around actually for quite a while. And so the researchers in this particular study, they wanted to see what was going on here. So what they did was they took two samples of 164 children total, to where they were looking for ones who had migraines, who didn't have migraines, who had colic as little kids, who didn't have colic as little kids, and had family history of migraine and didn't have family history of migraine. All right, so what they found is they found that 41% versus 36% of children who would have migraines versus didn't had a previous history with colic. So what that would point to is pointing to that there's approximately a 5% risk factor, which is not insignificant. May not seem like a huge number, but what it means is like, okay, there could be a connection here. And in addition to that, they're having a look to see, okay, children who experience colic, if they have a family history of migraine, which is not always a matter of, just familials or genes. Oftentimes things like migraine, they're categorized and say, oh, okay, my mother had it, my grandmother have it, my aunts have it, my uncles have it, so I must have it. Well, we don't exactly inherit migraines, but what we do inherit is we inherit the anatomicals, the bone structures of our ancestors, and certain bone structures or features that we have mean that our margin of error may be reduced. In other words, we are more susceptible to experiencing migraines. And the same goes with then sensitivities through our genetics to certain chemicals, to certain foods, to certain pollens, let alone the epigenetic factors. In other words, not a guarantee, but a risk factor, because our genes and our anatomy mean that we don't have as much wiggle room as somebody else might be. Yada, 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 is when people had family histories of migraines, then they were 47 basically, versus 30% more likely. So especially if you have that risk family of migraine in the family, more likely to experience colic and also be more likely to experience migraine. And so what do the researchers ultimately conclude? This is what's useful for our purposes here. There is a probable, not a guarantee, but a probable relation between colic and migraine. Therefore, migraine and colic, as two pain syndromes, may have a common pathophysiology. And further investigations on this common pathophysiology is justified. In other words, we think that there's very likely the same common origin that just shows up in two different ways. So when little kids, for example, they're inconsolable, they're moody, they're crying, they're all of this sort of stuff. Why? Because that's all that little kids really know at that point. They can't say, oh, my eyes hurt, my head hurts, my balance is off. They can't be saying, I'm feeling nauseated, which is the real hallmark of a migraine, that their vision is going funny. They can't say that, and so instead they are most inconsolable. So there seems to be a common underlying link. So this brings us back to, and it's not the single guarantee to say, okay, well, this is the missing link. That would be silly. But we can say, is it possible that a problem in the upper part of the neck is what's responsible for what's going on, especially following a physical injury? So let's have a look at that. Okay, what do we have? Everybody's favorite neurology. Yay! Well, neurology is most interesting when we can understand the wires and the connections in terms of what's going on in our bodies. And for our purposes right here, the most important thing is everybody's other favorite, Vegas, baby, Vegas. We're talking about the vagus nerve. We're talking about the 10th cranial nerve, the one that emerges off of the base of the brainstem, so just up from where your finger would be right here. And what it does is it conveys to your body all of, well, not all, but the vast majority of all of the control information that goes from your brain down to all of your internal organs. Your thyroid, your heart, your lungs, your digestive, your reproductive system, all of that comes down through vagus nerve. And it's also the one that's receiving all of the information back about the health of those same thyroid, heart, lung, digestive, reproductive systems. So very, very important, vagus nerve. We'll show you where its location is in just a second here. But what it does as it exits your skull is it crosses with a whole bunch of other nerves and sends and transmits a whole bunch of other fibers as well. In other words, it's not just going to your internal organs, it's going to some other stuff as well. And what are some of those other stuffs? All right, well, what we have is, it's going to connect here with the ninth cranial nerve, glossopharyngeal nerve, and it's going to send fibers out to the auricular nerve. What's the auricular nerve? The auricular nerve is a sensory nerve. What it means is it receives information back about this tiny patch that we have basically right by our ear, right through here. It also receives sensory information back from the inner ear. So the fibers, the information of what's going on the inner ear go back and they come back through the same vagus channel. It also receives sensory fibers from the first and the second cervical vertebra. What we're talking about here is we're talking about the upper two bones in your neck. So it's receiving sensory information about what's going on there. Pain, muscle tone, and also balance kind of information coming up through here. Particular emphasis on the pain one here as it's going to relate to migraine in just a second here. You may also notice that there are these little things that say to simp. To simp. What's simp? Simp are sympathetic nerves. Sympathetic nerves are responsible for controlling blood vessel dilation. And in this particular instance, we're referring to blood vessel dilation in your head and in your brain. Okay? Now, the vagus nerve itself doesn't send information to these blood vessels. What it actually does is it receives information back from some of these blood vessels and some of these inner linings. Of particular interest is a little something here that kind of coalesces with this first and second cervical vertebra, something that's called the recurrent meningeal nerve. What's the recurrent meningeal nerve? All right, your brain itself does not have neural receptors that detect pain or inflammation or anything like that. But the connective tissue around your brain, what's called the meninges, so the dura, the subarachnoid, pia, the blood vessels, so again, not the blood vessel too, but the information coming back is their tension information of those blood vessels. That information is received via this recurrent meningeal nerve. Yada, yada, yada. This is the pathway where the information from inside of your head actually coalesces down into the C1, C2, and is transmitted back up into the vagus nerve where that information is ultimately processed for your brain in terms of, is everything working right? Are you healthy or are you not healthy? Make sense so far? Okay. So now the next part of this is understanding the importance of having the proper information going to and from your brain and your body, that it actually ends up in the exact places where it belongs. But in the same breath, I want you to imagine the process of a traffic jam or of a computer. You know, computers, their programs are designed to function in isolated environments, and done testing, everything works fine. However, as we know, is that as you have a computer and it starts to accumulate more data, certain programs can suddenly start to develop certain corrupted functions. In other words, things that you think are supposed to work don't quite work anymore. Or if there's an update and there's some kind of a software error, or if you get malware on your computer, All these different kinds of things can cause things to start to work in an abnormal manner. Well, as powerful as the supercomputer of our brain and of our nerve system is, it is still a fallible machine. And the reason that that matters is it matters because if and when there might be an excessive volume of stress, so we can talk about the idea of a physical injury involving the upper part of the neck here. If that then is bombarding your brain with abnormal signals saying, help me, help me, help me, there's a problem, danger, 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 that all of that information can actually go into the system and overwhelm the circuitry. And so what'll happen is you start to get the crisscrossing of messages where sometimes that information is processed in the brain centers but is going to crisscross with other brain centers, meaning that you can have a quote-unquote danger pain signal, but if it ends up going into a slightly different part of your brain, you may have an altered kind of sensation. And the reason that this matters is because you can have then a mechanical strain, for example, in the upper part of your neck, but what you start to experience then are vertigo or abdominal discomfort, nausea, different things like that, even issues in and where with your chest or your breathing. It's what's known as a somatovisceral effect. It's where the sensory information from the mechanical structures under stress and strain starts to produce weird symptoms as if it's your heart, as if it's your lungs, as if it's your digestive system. And as it relates to migraines in particular, okay, the hallmark, as we said, of a migraine, it's not necessarily the pain, it's the sense of nausea. This is the crisscross. It has everything to do with that vagus nerve. Vagus nerve, remember, receiving the sensory information back from all of the internal organs, and a huge amount of that is going to be your digestion. So if that information gets crisscrossed with abnormal pain or sensory information, you may not be having physical pain, but what you may instead be experiencing your body as a shadow of that problem are actually weird abdominal kinds of symptoms. And if a person's got grumbliness or feeling upset in the stomach here, that's exactly how you can have these kinds of overlap problems. Now, the question is then, well, how is it that a misalignment in the neck could actually be producing, again, these abdominal symptoms? Well, I'll show you a little bit more on the neurology right here. Ta-da! Here we go. So we'll be looking at a side section here, person's nose, jaw, tongue, all that sort of stuff, and the back of the head. So we have basically a blown out version of exact same series of nerves that we showed you on the previous slide here. So there's our vagus nerve, vagus baby. So it'd be coming down like this. It exits your skull just in front of the tip of the C1 vertebra. So where I've drawn the arrow where the muscle here would otherwise be peeled back, you'd see that they've actually drawn this little bump. Well, that little bump would actually represent the top vertebra in your neck. So the opening at the base of your skull is going to include not just the vagus nerve, not just the glossopharyngeal nerve. This is involved with swallowing, speech, being able to move your tongue, yada yada. There's also one that's called the accessory nerve. This is the one that is allowing you to move your shoulders and is responsible for gross movements, posture distortions, all that sort of stuff. You have the internal carotid artery. The pair of them are going to be supplying about 2/3 of all the blood to your brain. And you also have the internal jugular vein, which is when you are lying down, is the preferred drainage pathway for blood coming back out of the head to go back to the heart. And we talk about in other videos how if you ever have a mechanical problem where you're not getting proper drainage of either the CSF fluid or of the venous fluid back to the heart, that what it can do is it can start to pool, produce a congestion, and a person then starts to experience brain fog, which means that they're not able to focus, not able to concentrate, and can also manifest as moodiness, for lack of a better description, There's something that just feels wrong with me and I don't like it, but I don't know what to do with it. So these are the structures that are actually located directly in front of that top vertebrae in your neck. And what they do, at least as it relates to the vagus nerve, I'll draw it and outline it here for you. It's going to have fibers, as we said. Well, some of those fibers right off the bat, they spin back and they go back up into the head, and those are that current meningeal nerves, which are giving the sensory information about how healthy is your brain. You've also then got fibers that branch out. They're going to go down to your thyroid, which is energy and hormones. It's going to go down to pulmonary branches to your lung. It's going to have branches that go down to your heart. And of course, it's going to have branches that go all the way down to the stomach, the the large intestine just as well. So imagine, if you would, here, and we're not talking about nerves that are getting compressed or crushed or anything like that. Now, we're talking about neurological stretch, neurological irritation. It's the difference between, there's like a pit fire. There's a difference between you sticking your hand in the pit fire versus you holding your hand about, 4 to 5, feet above that. In one instance, you will be causing immediate and severe crippling neurological damage. But in the other, you're going to be feeling the flame, and it might be hurting after a while, but it takes a while. And if you look at it, you say, oh, no, your hand isn't in the fire. That's important for people to understand. When you oftentimes have migraine or other kinds of symptoms, they're looking for overt pathology. That is something that you can see, such as a lesion, such as bleeding, tumor, infection, fracture, all that sort of stuff. That's like the hand is in the fire. What we're talking about now is we're talking about the hand is above the fire, which is still producing the abnormal symptomatology, but you're saying, okay, nope, everything quote unquote looks fine. Necessarily not. Now, when a person has some kind of a head injury, a neck injury, again, even if it doesn't break, doesn't dislocate anything, and say, whoa, that was scary, but I think that I'm fine. Well, I want you to imagine for a second just even what would be possible if that top vertebra in your neck would so happen to misalign forward. If it ends up misaligning forward, then what it means is that normal space where the vagus nerve and all those structures should be able to come down, it's not going to be quite as pronounced. In other words, that can start to produce a little bit of stress, tension, disrupting its function. Let alone if you've got the misalignment going on there, setting off those sensory signals up to the head saying, whoa, we've got a problem, there's a problem, there's a problem. Again, that information is going to go up via that vagus nerve, that recurrent meningeal branch, and it's going to be giving your brain that information saying there's a problem. But what it can do then is it can spill out into those other centers to say, all right, this is, we're not sure exactly what this is. It's overloading, and it's producing symptoms of nausea. It's producing symptoms of, heart palpitations, even sometimes symptoms of heartburn. Again, not to say that all symptoms of heartburn are because your neck, but if you rule out all of the other forms of pathology, don't forget the neck. That's the whole big idea. Symptoms show up in the body in weird ways that we don't think of as actually coming from up here. So that then kind of brings us around full circle to, again, where we've been given this question. Again, thank you very much for asking that question. And if anybody else wants more information, then please do. It's like, shoot me an email. Go to my website, drjeffreyhanna.com. Shoot me an email. I will happily do a video just like this. Again, this is not diagnosing, but this is more opening up the possibility. Is it possible that a problem in the neck could be related to these issues and at least deserves consideration and thus investigation? So what do we have for your grandson? We have a physical injury as the precipitating factor there. Well, with physical injuries, going down 20 stairs, honestly, even going down like 1 or 2 stairs the wrong angle would be more than enough. Even if they don't break, even if they don't dislocate anything, because little kids are stretchy, if it offsets something at just the wrong angle and it locks out of its normal position, what that can do is that can start then to produce that neurological tension interference. And if it's at that C1 and if it's at that C2 vertebra, understanding their relationship relative to where that vagus nerve is and understanding what the vagus nerve functions are, we can appreciate that the feelings of nausea and needing the bucket, but also the feelings of agitation, moodiness, not necessarily those of quote unquote migraine, but actually associated with it, that very likely we're looking at a different manifestation of the same thing. In other words, there is very likely a link that at least deserves the consideration and, as we said, most likely the investigation. And so there are those people out there, no joke, they say a person should not go to see an upper cervical chiropractor unless they're experiencing neck pain. Well, here we have a child with neck pain, or without neck pain, but guess what? They had a physical injury that involved their head or their neck. They were diagnosed with concussion. So guess what? This is probably one of the most important circumstances where a chiropractor is exactly who these children need to see. If there is concussion and if there are other behavioral issues, because of course, diet is a huge player in terms of behavior, and adjusting the neck does not always fix diet, but it is one irreplaceable and essential element for any person who actually wants to be well, whether they're 2 years old, 20 years old, or 80, 90 years old. It's important that your neurology is free, clear, able to work the right way. Otherwise, things are just not working right. And any person whose body on the inside is not well, even if we look fine on the outside, if we are not well on the inside, that information is not lost to your brain. Only about 0.000005% of all of the sensory information that goes on about our bodies we're consciously aware of. The other 99.999995% is unconscious. So if it's that system that is overloading this poor 2-year-old's neurology, it's of course going to show up in different ways. And a person who doesn't feel well, they have the tendency to lash out. They can be short-tempered. They are not feeling well in and of themselves. And so does that mean, having a look, seeing what's going on? I'd recommend, have a look. So if you're looking to find some help there, what we recommend that you always do first is you go to the Blair Chiropractic website, so blairchiropractic.com. Find the doc who's going to be closest to you. Now, if, of course, you're in the Spokane, Washington area, yeah, great. Or the Northern Idaho, Eastern Washington, certainly we'd be happy to help you out at Clear Chiropractic. But have a look, see who's in your local area, and they will do the very best that they can to help out. So hope that this video has been both valuable, informative, helping, give a little bit more information specific for your case. Again, not diagnosing, for basically for educational purposes only, at least for consideration, but that this also is going to be useful for other people who may have young ones who experience these issues, but they never think that it's related to their upper neck. So everybody, thanks for watching this one. If you have enjoyed it, please always do click the like and subscribe. That way it lets YouTube know that this is useful information so that other people are able to find it as well. If we've struck a nerve here, and if you're thinking there's a friend, family member who really needs this information as well, please do share it with them. And then certainly last but not least is if you've identified something that we've said here and thinking, okay, they might be able to help me out as well. What we'd have you do is go to our website, which is drjeffreyhanna.com. You can shoot me an email. I'll be happy to have a conversation to find out if we're in the right department, if there's something that we can do to help you out. And if you are ready or want some direct help right away, you can contact us at the practice. I'm part of the team with Clear Chiropractic. You go to clearchirospokane.com, or you call us direct at 509-315-8166. Mention that you saw this particular video here, that it sent you to us. We'll be happy to help you out and look forward to meeting you. Thanks again for watching. This is Dr. Jeffrey Hanna with the Big Idea from Clear Chiropractic. Get well, live well, stay well. So until next time, take care and bye-bye.